Thank you, Madam Chair. My first question for Dr. Cavazzoni. Last week, we received a letter from Commissioner Califf on FDA's changes to mifepristone risk evaluation mitigation strategies for medical termination of interuterine pregnancies up to 70 days of gestation. I want to submit for the record a study from the Health Services Research and Managerial Epidemiology, and basically it talks about chemical abortion increased ER visits by 500% from 2002 through 2015. As a OBGYN myself, certainly I was the doctor taking care of these complications, though I never would have ever considered prescribing this drug. Our big concern is this is now going to be done over the phone or through telemedicine. And based upon my clinical experiences, a woman's guessing of her gestational age is exactly that. It's a guess. And trying to make that determination even physically by putting your hands on that woman's uterus is off easily a month or two. Really, without an ultrasound, I'm very concerned about this drug being prescribed through telemedicine or over the phone. How can the FDA stand by its current policy knowing there's a direct correlation between ER visits and the chemical abortions, depending upon some to take care of the complications created by another physician or most likely a nurse practitioner or PA's doings? Do you think it's safe to mail these dangerous drugs, even potentially to underage women, without going through proper diagnostic protocols, including ultrasounds?
Thank you, Senator. Just to clarify some of the aspects of this, as part of litigation that FDA was involved in, we undertook a review of the mifepristone REMS, asking ourselves, is the REMS still necessary, and should and are any modifications warranted to the REMS based on the data that are available? And under this exhaustive review of the data, which entailed data from our adverse event reporting system, data submitted from stakeholders, the litigants, and the sponsor, we concluded that the REMS has to stay in place. And the REMS entails a requirement for confirmation of gestational age. It is not prescriptive on how that is done. It leaves it up to a standard of care for the prescriber, but it does require confirmation of evaluation of gestational age. We also determined that as part of the REMS modification, the drug is safe and effective, and the benefit outweighs the risk. But if the in-person dispensing requirement is removed. Having said so, we also introduced a new requirement for pharmacies to be certified in order to be able to dispense the drug. And these are the safeguards that are in place right now, and we believe that those safeguards will ensure that the drug is the drug's benefit outweighs its risks.
Yeah, I can only wish the people prescribing these drugs were in the ER taking care of these patients at midnight and 2 in the morning and taking care and seeing the complications from the drugs themselves. And my guess is this will turn into a huge technology financial gig for certain companies. They will set this up to be very profitable, and many, many women are going to be harmed because of your decision.